Hello everyone. Today I'm going to talk about the BNS 106, what every emergency patient must know. See, if a patient died in emergency department, can a doctor go to jail under BNS section 106? That is the question. The answer is, it is not as simple as yes or no. See, BNS section 106 deals with causing death by negligence. For a registered medical practitioner performing a medical procedure, the provision specifically provides for imprisonment for up to 2 years and fine if the legal requirements for the offense are established. But here is the most important point for every doctor. See, that is, a patient dying does not automatically mean the doctor was negligent. See, there's a huge difference between a complication, an error of judgment, negligence, and criminal negligence. If a patient can have a known complication despite receiving appropriate treatment, a doctor can also make an error of judgment while managing a critically ill patient with the incomplete information. So that doesn't automatically mean a criminal negligence. The court have consistently recognized that a criminal medical negligence requires a much higher degree of culpability than an ordinary error or civil negligence. And this is particularly important in emergency medicine because in the ER, we often make decisions with incomplete history, limited information, time pressure, diagnostic uncertainty, and a rapidly deteriorating patient. So don't practice medicine with fear, because practice with a good clinical reasoning and good documentation, because the documentation is extremely important. So don't simply write a patient was critical, don't write like a treatment given. So instead of that, we have to improve the document, like the patient expired despite treatment, instead of document the clinical story. So for example, like what are the initial vitals? So what did you find on examination? What were your important differential diagnosis? So what investigation did you order? What treatment did you give? And most importantly, why did you choose the treatment? Then document the patient's response, and if the patient is deteriorated, what you do, what did you did, who did you inform, and when did you escalate the situation, was ICU admission or specialist consultation required or not, was a transfer required, and all this to be questioned. And for example, instead of simply writing NIV started for this patient, so don't do that. Instead of that, document why the NIV was started, the patient clinical condition, the relevant contraindication considered, and how the patient responded after starting it. So remember this simple formula: time, finding, action, reason, response, and finally escalation. So this is especially important in emergencies. And if a patient or family refuses admission, CT, surgery, ICU care, or transfer, don't just write family refused, because document what you recommended, why you recommended, the major risk explained, the alternative discussed, and the decision made. Also, never alter or backdate a medical record after an adverse event. Say, if a genuine clarification is required, use your hospital proper addendum or a correction process while preserving the original entry. And one more important point I would like to explain is don't practice insight medicine. That is, a diagnosis that became obvious 6 hours later may not be an obvious when the patient first arrived. So the question is not simply did the patient die. The important questions are what was known at the time, was the assessment reasonable, was appropriate treatment provided, was deterioration recognized and escalation appropriate, and was there a negligent act or omission that caused the death. So as emergency physician, our takeaway is very simple, that is, bad outcome does not automatically mean bad medicine. But when an adverse outcome occurs, your clinical reasoning should be visible in your documentation. So treat the patient, think clearly, escalate early, and document objectively. This is what every emergency physician should know about this BNS section 106. So do read about, have an idea about this BNS section 106, and which is helpful for all the medical legal cases, and for all the medical legal professional the way how we medical legally we have to act in the hospital environment. So do read about BNS 106 section. Thank you.